Hey guys, welcome back to my channel, The ENT Resident. Today I'll be doing something different. Today I'll be picking up a topic which is actually quite important and very difficult to understand at times. And our topic name is False Negative Rinne Test. And I'll be discussing it in the form of an MCQ. A lot of times in our entrance examinations, we get such MCQs and we do not know how to approach this. It starts to get kind of difficult to understand. Okay, there's so many things being told. How do we interpret the tests being given to us? So today I'll be giving to you a MCQ on false negative Rinne, and I'll be showing you how to approach it, and we'll come to the answer, and then we'll discuss what is false negative Rinne. You can also now purchase my notes. I have added links in the description. Okay, let's get started with our MCQ. So, a woman presents to you in the OPD with hearing loss. On performing the Rinne's test, we saw that it is positive on the left side and negative on the right side. On Weber's test, the sound gets localized to the left side. Now, what is our most probable diagnosis? Option 1 is left severe sensorineural hearing loss. Option 2 is left conductive hearing loss. Option 3 is right severe sensorineural hearing loss. And option 4 is right conductive hearing loss. Now, when you see such a question, how are you going to approach it? When we start seeing a lot of this positive and that negative, this localized to the left side, it starts kind of getting confused in your head. So, our first approach to remember is we will always make a table to see what test is what on which side so that we have it in front of our eyes. So, we have Rinne and then we have Weber. So, we found out that Rinne is negative on the right side and it is positive on the left side. And for Weber, we found that it has localized to the left side. So this is the findings that we have over here. Now from this, we have to infer which one of the options given here is our diagnosis. So let's start from Rinne's. So if we have seen Rinne's is negative. So do you remember the mnemonic that I had said? CORN. That means in conductive hearing loss, we see Rinne to be negative. So if it is negative, that means that right side has to be CHL, which is conductive hearing loss. And if Rinne is positive, that means it is either a normal person or a person who has sensorineural hearing loss. So this much is clear, right? These are our interpretation from the Rinne test. But now when we are seeing the Weber's test, it is saying that the Weber gets localized to the left side. Now what are the possible inferences? If forget about Rinne, if Weber was localized to the left side, what would be our possible inferences? So in conductive hearing loss, we know that Weber gets localized to the poorer ear. That means if it is localized to the left side and it is a conductive hearing loss, it has to be a left conductive hearing loss. And for sensorineural hearing loss, we have seen that Weber gets localized to the better ear. That means if Weber has been localized to the left side, if that is the better ear, that means this could possibly be right sensorineural hearing loss. So these two are possible options from our Weber interpretation, and this is our possible options from our Rinne test. Now we have to combine them, right? So if Weber is seen to be left conductive hearing loss, in that case, what do you see in conductive hearing loss in Rinne's test? It should have been left negative Rinne, right? But we are seeing over here that left side is positive Rinne. Now, considering the second possibility, if there is a right sensorineural hearing loss, that means when you perform Rinne on the right side, you should be getting a positive Rinne's test. But according to our test over here, it shows that right side is negative. So none of our answers are matching over here. So that means it's not a very straightforward answer. Our answer over here is possibly the right side has a sensorineural hearing loss, which is showing to be a false negative Rinne. What does this mean? Where do you see false negative Rinne? We see false negative Rinne when there is a unilateral severe sensorineural hearing loss. That means our answer over here is right severe sensorineural hearing loss. Now let me try to explain to you what exactly happens in a sensorineural hearing loss. Now imagine this is our ear. it goes into the cochlea over here. This is our right ear, and this is the cochlea of the left ear. Now, when you're performing the Rinne's test, we are testing both air conduction as well as bone conduction, right? So, if right side is having a unilateral severe sensory neural hearing loss, that means this cochlea is severely damaged. It cannot perceive anything. So, first is we are giving air conduction. So, when air conduction sound is being given over here in Rinne's, first before this, you need to remember that in Rinne's test, we are comparing the air conduction of the ear with the bone conduction of the same ear. So we'll be testing both. So now when you're testing air conduction, because this cochlea is severely damaged, it is not able to perceive this air conduction. Now, second is we are giving bone conduction. So again, because this right side cochlea is severely damaged, the right side cochlea is not able to perceive anything. But what is happening is this bone conduction is transmitting through the cranial bones to reach the left-sided cochlea. Now, because the left side cochlea is normal, the patient is able to perceive bone conduction. So what is ending up being is the bone conduction is being better than air conduction in this case. Now, because bone conduction is better than air conduction, this is our typical Rinne negative. But this is a false result because the bone conduction was not perceived by the same side, it was perceived by the opposite side. That is the reason why we are calling it to be a false negative Rinne. And the answer for a false negative Rinne is always a unilateral severe sensory neural hearing loss. So this right here is our answer. I hope you have understood this. If you have any confusion regarding this question, and if you have any confusion regarding how to approach when we get such an MCQ question in our entrance exam, please note them down in the comment section, and I'll get back to you regarding it and try to explain it more. Thank you.